Hello, I'm Chetlen Crossnoe. I'm a family medicine doctor here at Grace Clinic in Lubbock, and welcome to Health Topics. Today we're going to be talking about a very common problem, upper respiratory symptoms. As you probably know, most people deal with this at some point in their lives. And most of the time, these kind of symptoms come and go within a week or so and don't cause any major problems. However, a lot of times people can get very frustrated with this because they will have recurrent upper respiratory symptoms, or it just goes on and on for weeks and months at a time, or even intermittently for years. So really the reason that I put this talk together was to address why sometimes upper respiratory symptoms can be difficult to diagnose and hard to treat. So let's talk first about what is the upper respiratory tract. Now I'm going to use a little bit different definition of this than you might find in an anatomy textbook. In anatomy, the upper respiratory tract refers to above the larynx, so the pharynx, the nasal cavities, the sinuses. But for clinical purposes, there's several adjacent structures that tend to get sick at the same time with the same things. And so I usually include also the bronchi with the upper respiratory tract, even though technically it's the lower respiratory tract. But it tends to get sick with the upper respiratory tract, and that's different than pneumonia, which is illness in the lungs themselves. And then also I include otitis, which is infection in the ears, especially otitis media, and then conjunctivitis, which is the covering of the eyes. All of these structures tend to get sick in the same way and at the same time as the upper respiratory tract. So let's take a step back for a minute and see why that might be. Why is it that our common illnesses tend to be between about right here and about right here? I would suggest two reasons for that. First of all, there's a number of very delicate and very important sense organs in this area, the eyes, the ears, nose, tongue, that require close guarding by the body. And then second, this is the area where things are taken into the body, right? Food, water, and air, all of which could contain either substances or organisms that could be dangerous. And so the body spends a lot of energy and attention to this area. That's why we tend to get sick at that area a whole lot. Let's put our upper respiratory symptoms all together in this box. So I'm going to talk about pharyngitis, bronchitis, sinusitis. Now, when I say these things, anytime in medicine we say something -itis, what we mean is inflammation of the something, right? So pharyngitis just means inflammation of the pharynx. Pharynx is the Greek word for throat, so it's an inflammation of the throat. It's a sore throat. People come into clinic sometimes and they tell me they've got a sore throat. I tell them they have pharyngitis, and they think I'm really smart. I haven't said anything, I've just changed languages, right? Which brings us to, are these things really diagnoses, or are they just symptom clusters? Sometimes people come in and say the doctor told them they had bronchitis. Unfortunately, that doesn't have a lot of information in it. If you tell me you're coughing, I can tell you you have bronchitis. That's what coughing is. So pharyngitis, bronchitis, these are really just symptom clusters. Now, if we say bacterial pharyngitis, then we're implying we know what is causing it, right? Or even better, streptococcal pharyngitis. But right now we're just talking about symptoms. Then we're going to get to causes. So pharyngitis, bronchitis, sinusitis, rhinitis. Rhinitis is runny nose and sneezing. Otitis, that's pain in the ears, and then conjunctivitis is itchy, watery eyes, right? So these are the symptoms. I do want to mention another couple of symptoms just because they're things that tend to happen when we get sick a lot, and that would be like a headache and nausea, vomiting, diarrhea. I'm going to leave those aside because they don't usually help us make diagnoses very well, but they can go along with this. And then one big one that is important is fever. Physicians get real excited about fevers. Of course, the technical definition of a fever is above 100.4 degrees. And that's because at that point it really helps us with diagnosis. When somebody feels ill, but they have below 100.4 degrees, maybe 99-degree fever, well, that's really a low-grade fever. That has some information, but it doesn't help us with diagnosis as much. So what are the things that cause this? I'd like to suggest we divide this into two broad categories, and that is infectious. I'm going to try to write this a little better. And non-infectious. And then what causes most upper respiratory infections are either bacteria or viruses. And then non-infectious, this is usually allergic or allergy or non-allergic. So now what is non-infectious, non-allergic cause? We'll get back to that, keep that in mind. So before we move on though, I want to talk about a couple of things that make diagnosis difficult here. The first one is that even though we can get some hints, and we're going to talk about that more in the future, and that there are some tests to help us distinguish these, there's no 100% way to know in many cases exactly what's going on. Most of the time we just have a good educated guess. The second problem is all of these are very common. There is no reason why in a given person at a given time you can't have 2, 3, or even 4 causes going on all at the same time. That also really complicates diagnosis. So keeping those difficulties in mind, let's talk about these things. So what is the non-allergic, non-infectious, non-allergic cause of upper respiratory symptoms? Well, first of all, to answer that, let's talk about specifically about what an allergy is. We use the word allergy sometimes very loosely. Sometimes people will say that I ate some bad food, I got sick to my stomach, I must be allergic. You're not allergic, that's just the normal reaction to having bad food. Or you might say I took a blood pressure medicine and I felt faint. That's again not an allergy, that's just an adverse effect of that medication. A true allergy is when the body, the immune system responds on a molecular level to a specific antigen or a specific substance in the environment which actually is not dangerous, like pollen or cat dander. In those cases, the body sees that substance and believes it's something that is dangerous and activates the immune system even though it's inappropriate. That's a true allergy. So then, what is a non-allergic, non-infectious cause? Well, this is actually fairly common. There's a number of these. For example, there's something called gustatory rhinitis. That is drainage caused due to eating, usually spicy foods or alcohol. There's a medication-induced rhinitis. There's hormonal rhinitis. But in our environment here in Lubbock, Texas, probably the most common cause is just an environmental rhinitis or sinusitis. That's because of our dry air and dust that gets in and it irritates the mucous membranes. It causes them to become inflamed and react as if it had an infection, even though it doesn't. And they get inflamed, they produce a lot of mucus and get really congested. It's really very common. So then what about infections? Well, most upper respiratory infections are caused either by bacteria or viruses. You may remember from high school biology, bacteria are small cells that have their own metabolism. They take in something as food, use it for energy to grow and replicate, right? They cause infection because they're trying to find a home in our bodies. Some of them secrete certain chemicals that enable them to break up tissues and get in there and cause an infection. Viruses, on the other hand, are very simple particles that do not have their own metabolism. They're really just genetic material contained inside a capsule that gets into one of our cells, and then basically that genetic material gets out and hijacks our own metabolism to create more viruses, and so it takes over our own cells. It's a little bit different mechanism of infection. Okay, so now that we've talked about these different causes, let's start thinking like a clinician and see how would we tell these things apart. The way we go about this usually is by asking questions. For example, does the patient feel sick? If they feel sick, then sometimes people come in and say, hey, they've got this terrible drainage and congestion, but they really feel okay. Well, that would suggest more of a non-infectious cause. Whereas if they feel sick, we think it's more likely to be over here. How about a fever? That kind of is in the same category. If they truly have a fever, it is more likely to be on the infectious side and less likely to be on the non-infectious side. Have they been exposed to somebody who was sick? Again, that would be infection. Does this happen at the same time every year? In that case, more likely to be allergic or possibly environmental. What about the time course of the infection? If something is sudden onset, they suddenly feel very sick in a short period of time, and they've maybe only been sick for a few days, that implies infection. If this is something that's been going on for weeks or even months, or just comes off and on a lot, more likely to be non-infectious. So what I hope you can hear from that is that we can kind of tell the difference between infectious and non-infectious. How about telling among the categories? Well, if you're having something that seems to be a non-infectious upper respiratory symptoms going on for a while, you need to have allergy testing. The allergy skin testing is really the way you tell somebody has a true allergy. If they don't have allergy, then you have to start thinking about what would be the non-allergic causes. And what about infections? Well, there are a few things. One thing, people get real interested in the color of their mucus, right? But that really doesn't help us between infections. I mean, if you have just watery, clear mucus, that is more likely to be non-infectious. If it's yellow, green, and gooey, then that's the reason it gets that color is because of the breakup of cells, mostly our own cells, but also bacterial cells, and that is more like an infection. But it doesn't help you tell between bacterial and viral. Fever, maybe a little bit more bacterial, but even viruses can cause fever. Sometimes we have to really depend on testing here. There are, of course, rapid strep, rapid flu. Even though those can be serious infections, we get real excited when we get that because then we can tell people exactly what they have with a reasonable amount of certainty. There are some viral and even bacterial panels now available where you can check a large number of infections. Unfortunately, these are still in the thousands of dollars, and so they're really not practical for regular clinical use. But I hope that in the future we're able to do that. So I hope you can see from all of that why sometimes it's difficult to figure out exactly what's going on in a given situation, and then even if you do figure it out, there may be more than one thing. So now, what about treatment? I don't want to get into treatment too much. There's a lot there, but I do want to talk about 3 topics real quick. The first one is that usually sometimes simple things are the best, right? For any of these problems, you've got to start a treatment plan with appropriate sleep, good hydration, and good nutrition. The old doctors are always talking about make sure you get plenty of fluids and chicken noodle soup. There really was good advice there. And in the long term, even though when you're sick, you can't really do a lot of exercise, or you probably shouldn't, but in the long term, regular exercise can really help decrease the incidence of these things. Second thing I want to bring up is about steroids. People frequently come into clinic with upper respiratory symptoms asking for a steroid shot, and that can be very helpful. But I want to clear up some misunderstandings. Steroids do not help your immune system. The reason steroids work is they suppress your immune system. They decrease your reaction to things. Now that you know this, you know when steroids would be appropriate, right? If you have a non-infectious cause, then your immune system is activating when it doesn't really need to, and suppressing it would be appropriate. If you have an infectious cause, you have to be a lot more careful, especially a bacterial illness. Sometimes you can get away with steroids for viruses, especially in young, healthy patients. Another problem with steroids is you can't give them too often. Frequent steroids can cause a lot of very bad side effects. So in my clinic, I like to wait at least 3 and preferably 6 months or a year between steroid shots. Then the third thing I want to talk about is antibiotics. Again, now antibiotics are, well, so as we said, bacteria are organisms that have their own metabolism, right? And in fact, some of their metabolic processes are different than ours. They make cell walls. We don't need that. So we can attack their ability to make cell walls, and that doesn't affect us. And so there are some real good antibiotics out there. Antibiotics have really changed the world in the last 70 years. Before that, most people died of infection. Now they don't. However, you can certainly be overused. As you can see, a fairly small number of the total amount of upper respiratory infections are actually due to bacterial infection. And so you really should only use antibiotics when you have a strong suspicion of a bacterial infection, or if the patient is somebody who could be seriously hurt if we miss a bacterial infection, and that's usually the immunocompromised or people who are very elderly. Okay, I hope this has helped you with understand the upper respiratory symptoms, and thank you.